I'm here for my treatment, the EVA treatment. It's a radiotherapy treatment for vaginal anatomy. So follow me and get to learn and see what we're going to do. Definitely not everything, but just to learn more about it. We are at Fortis Tower, Upper Hill, 6th floor, and the name of our clinic is called Alora Medical Center, and it's so pretty. Hey guys, I'm here at Dr. Sule, like I mentioned. I came for my treatment today. I just wanted her to explain a little bit about the treatment I'm going to have today, the machine. I already filled my consent form. Remember, when you come for any procedure, you get to fill a consent form and to understand what your treatment is before you actually put pen to paper. So Daktari is going to do what she's doing today, and then we'll go into the treatment room. We'll show you the treatment room, a bit of the machine, and then we'll start.
So thank you so much, Catherine, for coming in today. I'm so excited. You're one of our first patients to receive this treatment. It's called, the machine itself is called the EVA. So it's short for Enhancer of Vaginal Anatomy. And basically it's a radiofrequency machine that does a radiofrequency vulvovaginal rejuvenation. So basically what we're looking at is when you come in, as usual, we give you the consent, we explain the procedure to you. But some of the things that women come in for this particular, everyone has their own reason, but we offer them this brochure. And as you can see, some of the solutions to the problems that are available through this machine is like vaginal dryness, dyspareunia, itching, pain. Dyspareunia means painful sexual intercourse. So there are some women who have painful sexual intercourse that has no, identifiable factor, and radiofrequency treatment is one of the ways to treat it. The main treatments that it generally attends to is vulvar and vulvovaginal atrophy, which is where there's aging of the vulva and of the vagina, either through age or through hormonal influence or through repeated vaginal deliveries. And the other thing that it attends to is vaginal laxity. So basically here we're looking at a non-surgical vaginal tightening procedure that can be performed with radiofrequency energy. Then it also attends to stress urinary incontinence. So the women who have a little bit of pee coming out or leaking every time they cough or they sneeze or they laugh, as long as it's not severe. Of course, if it's severe, they require surgery. But if it's not severe, then radiofrequency energy is a very good alternative for treatment, and it actually, forms part of a cure. And then, of course, we have external vulvar rejuvenation, so which means we are looking at improving the outer appearance of the female genital structures. We're making them fuller, we're making them younger, and the appearance change is really dramatic. It's you'll see for yourself.
Like a 17-year-old.
Close to.
I don't even remember 17 when I'm looking down there.
But so what we're going to do is we're going to take pictures. We're going to do before pictures and we're going to do after. And after every session, we're going to do a photograph as well, so that you can see your progression through each of the treatments. Unfortunately, of course, we can't tell what's happening inside the vagina, but that is something that you will report for yourself. And of course, we give you the instructions before, what to do, what to avoid prior to the treatment, and then also your expectations from week to week following the treatment.
Okay. Yeah. How many of these do you need? I know that's a question that I'm going to ask. So that it's good sometimes to be clear. It depends on your condition, or normally it's the standard.
It actually does depend. So the standard is 3 to 4 treatments. However, for women who have had several vaginal deliveries, we can even go up to 5 treatments. So it really does depend. Or for women who have severe atrophy of the external genitalia or the inside of the vagina, then we can increase the sessions. But generally what we provide is 3 sessions, and then we give you 1 session free, and then it's up to you to decide whether you want to come for the session or whether you feel like the treatment is sufficient for you.
Okay. Yeah. So would you tell clients it takes time to see the results, be patient? Like some clients, it depends on every client.
So honestly, with our previous machine, it was a monopolar device, and that meant that the area of emission of the radio frequency was only one. It had only one metallic part that could emit the energy. Yeah, but now this is an upgrade to that machine. It's a quadrupolar energy, which means there are 4 sources of the radio frequency emission, which means it covers a larger part of the vagina. It penetrates the deeper tissues of the vagina so that the surface of the vagina is left unaffected, but the deeper tissues start forming more and more collagen, and hence they tighten. So with this machine, actually the effects are much more dramatic than they are with the previous one. I'll show you some pictures of patients who have had changes even after one treatment. So usually I would expect patients to wait, let's say 2 weeks. To
you can't have it today and then you call tomorrow or not. That's what I mean. It's very good to be clear, because we're all different. Sometimes you're impatient because I want to see the results and I'm excited. So give it time. And ensure to finish your sessions.
Ensure to finish your sessions. And that's the thing. So we discourage having one session and then seeing the effect and feeling a little bit different, and then discontinuing the treatments, because we want you to have the full effect of all the treatments. So you may feel amazing, but it could get so much better if you could just complete your treatment. Yes.
Okay, guys. I think these are the questions. Oh, I know the question you guys are going to ask. Another question is it painful?
Oh my goodness, it's not painful at all. So remember, this treatment is a non-hormonal, non-surgical treatment. It does not require any anesthesia whatsoever. It's the opposite of painful. It's actually quite pleasant because it's warm and we apply gel, and it's just like a massage both on the inner surfaces of the vagina and on the external female genitalia. So it's not painful at all. We don't use any anesthesia. And one plus of radio frequency energy to do the rejuvenation, other than laser or ultrasound, is that there's no downtime. So there's no wound, there's no pain, there's no sick off. You can resume all your activities the same day. You can ride a bike, go for aerobics, you can have sexual intercourse the same day.
So you can come for this
even
within
an hour.
Coffee break.
It's a lunch break procedure, yes, I like to call it that. So no pain whatsoever.
So I can be sipping my coffee, I can be on my iPad. Okay,
yes.
Nice, guys. So I think that covers most of it. Obviously, guys, if you have any questions, feel free to, I'll give options. You can DM the doctor directly, you can send an email, you can get in touch. As we always say, information is key, and Achari is here. She's actually very, very patient. She's a gift. She said she will always explain things to you before you get into something. And I'm sure, Dr. you've seen a lot of women improving. And also, it's also a step of faith, guys. I always say that it's a step of faith. In everything in life is about trying. If you've tried something so far it hasn't worked out, why not give it a shot? You never know if this might be your solution. Okay, guys, so we'll enter the room, and then you get to see the new baby, the new machine. It's about to be my best friend.
So basically, this is the machine. It's called EVA.
Baby.
Yes, EVA.
Standing for Enhancer of Vaginal Anatomy.
Yes, Enhancer of Vaginal Anatomy. It's a purely Italian machine. All the parts are manufactured in Italy. The technology behind it is Italian as well. These are the probes. So it has 2 probes. It has an intravaginal probe, and then it has an external probe. So we have different probes for doing different treatments, which is an excellent thing, because that means that the manufacturer has considered the fact that you cannot use the same equipment to treat the inside of the vagina as you do the outside. They're completely different structures. They require different shapes and different sizes and completely different things. And so the metallic parts that you see here are the radio frequency emitter. That's where the heat comes from. Yes, that's where the magic comes from. And as you can see, the shape is very friendly. It's not big. It's not, extremely invasive. Seems quite comfortable, right? Yeah. So, and the one
which was like quite big.
It's not big at all, and it's not painful. So what we usually do, we apply a specialized gel. It's not regular gel. It comes again from the manufacturer of the machine, and it's a much better gel compared to the most that are available in the market, because it has glycerin. It's very thick, so during the treatment it doesn't continuously pour out of the vagina. It's actually quite oily and nice, and so you won't have a lot of discomfort even after the treatment as well.
You don't have to feel like you need to wash up, because it's not unsafe, and it doesn't have any chemicals.
Yeah. not at all. And so what we usually do is once we turn it on, the best thing about it is that unlike previous or other machines where you just do the treatment, this one you actually select what you want to do for the patient, so which will depend on the patient's complaint. So if she has incontinence, it has a setting for incontinence. If she has laxity or would just like to tighten up, there's a setting for that, yes. If it's just the vulvovaginal atrophy and maybe she's around menopause and the tissues are getting dry and irritable and now there's pain during sexual intercourse, it has a setting for that. And then it has a completely different setting for the outside of the vagina, so the vulva. So it's an intelligent machine. It's not just about performing anything or any kind of radio frequency in any area. It's now specific to each area. The temperature is also regulated. It has a thermostat, so there is no chance of burning. When the machine, there's no overheating. When the machine gets to a certain setting and the tissues are gotten to that temperature and it's now too high, it simply switches itself off. Yeah, so it's a very intelligent machine. It's amazing, and I love it. And the response so far has been amazing. Yeah.
Okay, guys, so it's my turn. I can't wait. Obviously, pictures I had to share, but guys, I'll say the truth of how it works for me. So I'm excited to start, and like she said, not more than 45 minutes or 1 hour, and it's very relaxing, so I'm not scared.
So everyone, we're about to start the treatment. We're going to take some pictures first, and then we're going to do pictures after the treatment. So see you in 45 minutes.
Hey guys, I'm done with my treatment. I'll just tell you a little bit about it. It didn't take much, maximum an hour. The rest were just chatting our own things. We are ladies. So it wasn't uncomfortable at all, Daktari. I'm going to be very honest. I'm not saying that Tavia was not a good machine, but it was more comfortable for me. Maybe the shape.
It's more ergonomic.
And maybe that big word, ergonomic. Yes, that one. And I felt like on the inside it was more comfortable. It was more comfortable, and like I said, I was on my phone, I was chatting on the phone, picking phone calls, you can work, and her place is very comfortable, and there's a good view plus, there's a good view. So I didn't realize it, the time going, and like I said, this is a lunch break procedure, guys. It doesn't have to take too much of your time. So let's please give it a chance, and I'll let you know, because we're doing 4 sessions, so 3 sessions, and then Daktari is doing in one. Yeah, because she's passionate about her job. It's like she is really, really passionate. I've never seen someone so passionate about her job. And I'm glad about the new machine, Daktari. And how you're always continuing, growing and learning.
Thank you.
Yeah, so I'm proud of you. So guys,
give you guys the best.
Yes. So guys, until next time, definitely more procedures. Me, experiment. And definitely we will be updating you more videos. Please feel free to ask questions, any questions. Like I said, if you feel uncomfortable asking them directly to me, I'll give you the doctor's handle, her email, so you may be able to ask her directly and get solution. Ladies, this is 2020. You don't need to suffer in silence.